Welcome to the video, Deconstructing the Great Psychotherapy Myth. Both clients and therapists are wrong about how psychotherapy actually works. My name is Dr. Stephen Bacon. I'm in private practice in Santa Barbara, California, and I've spent the past decade writing books and investigating the topic of how psychotherapy works. First, our good news is that psychotherapy works. It has an effect size of 0.8, which means that people who participate in psychotherapy are better off than 80% of a waiting list control group. Put in terms of how many people get better, which is slightly different, roughly 55% of the people who participate in therapy get better. The other 45% either drop out, get worse, or are unchanged. In this next section of the video, we're going to be looking at some assumptions about psychotherapy that are held by almost all clients and almost all therapists. The first assumption is that psychotherapy works like medicine, begins with an illness. Then we have a carefully trained professional who makes the correct diagnosis. And finally, that same professional looks in her toolbox and picks the correct evidence-based technique that will resolve the issue. The client gets better. Most clients and therapists believe that psychotherapy is evolving. That's due to the presence of research, which is always looking for new ideas and gathering more information. It's because we develop new systems and new ways of doing therapy that are held to have better results than the old system. And we have new approaches that are particularly designed to work with people that have severe mental health problems. For example, EMDR for trauma. Another area of agreement among clients and therapists is that therapist training is effective. Our current training programs are better than old ones. Our supervision is better than it used to be and key to learning how to become a therapist. While less trained people can help a few folks, clearly to deal with seriously mental ill, you need a comprehensive training program. Two areas that are central in the evolution of psychotherapy are a focus on techniques and client characteristics. Almost all of our evolution is because we're inventing new techniques that we believe work better than our old techniques. Similarly, we are always learning more about specialty populations, like characteristics of alcoholics or bulimics. That enables us to do specialization and to beat out people that have not been trained. Common sense supports the idea that the more experienced a person is, the better they function as a therapist, since they've learned a lot in their years of practice. Similarly, specialization is also considered a way to enhance effectiveness. Obviously, if you specialize in adolescents or alcoholics, you're going to be better at working with those populations than standard people. While it's difficult to believe, virtually every statement in the past 5 slides is incorrect. In the following slides, we're going to replace them with accurate statements about how psychotherapy works. One of the most shocking findings in the research is just how well beginners do at psychotherapy. In fact, when you look at the literature, you realize that essentially beginners match the results achieved by licensed, trained, and experienced psychotherapy professionals. Hard to believe, but the research bears it out. One of the most surprising revelations from the research is that our psychotherapy training programs are almost completely ineffective. Even when we do something fairly obvious, like observe the most talented therapists and ask them what they do, we can't seem to emulate their success. Another area that we find rather baffling is that experience does not seem to improve outcomes. More experienced therapists, in fact, appear to have slightly worse outcomes than less experienced therapists. In addition, specialization doesn't work in psychotherapy. Apparently, a general therapist can do just as well as a specialized therapist, even in highly technical areas like eating disorder or substance abuse treatment. A discussion of techniques in psychotherapy is fairly complex. Suffice it to say that the research supports the idea that our interventions are more like rituals than independent techniques like you see in chemistry or physics. One of the things that's most important to understand is that in psychotherapy, beliefs and expectancies are the most important. If you believe something will help you change, then in fact it will. As you will notice, as we review the literature in the next couple of videos, all of these conclusions pop out of the literature. They are an open secret and they are available to anyone who wants to look at the literature. There are no hidden or secret studies. The reason this material has not been accepted by the psychotherapy world is because it is simply too painful to understand psychotherapy this way, too contrary to common sense to let these conclusions in. The next couple of videos take a close look at the research that substantiates these surprising conclusions. Following that, we're going to be trying to work on an explanation. How come psychotherapy is so different than chemistry, physics, or medicine? Following that, we'll be looking at how we can use this material both for psychotherapists who want to increase their effectiveness and for personal growth advocates who want to integrate it into the challenges of their own life.